This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
We're working to connect a region of over 600 million bridges between our lands.
Hello, I'm Alma Angeles. Welcome to ASEAN in Focus. We're coming to you live from Manila and Thailand. Hello, Gila.
Hello, good afternoon, Alma, and good afternoon to all of our viewers. I'm Gila Pablo from ABC Thailand, bringing you the latest news around the dynamic ASEAN region.
On today's headlines.
Here
in the country, Dr. Cynthia Saloma of the University of the Philippines Philippine Genome Center reported 17 Delta variant cases in the country, all from international travelers.
President Duterte said wearing face shields both indoors and outdoors is still mandatory, especially with the detection of the new Delta variant in the country.
The EU added 8 officials from Myanmar's junta and 3 firms linked to the military to its sanctions blacklist over the country's February 1 coup and bloody repression of protests.
All thin and brightly colored Hanoi soup houses dominate the city's streets as 9 million people compete for space in Vietnam.
First, here in the country, Dr. Cynthia Saloma of the University of the Philippines Philippine Genome Center reported 17 Delta variant cases in the country, all from international travelers. Dr. Saloma said that strict enforcement of border controls must be imposed to curb the spread of these variants. Take a look.
Ngayon po, meron tayong 17 all in all na mga Delta variants na whole genome sequencing dito sa Philippine Genome Center at may lahat po sila puros international travelers. So far po, we have not detected any community spread. So ano po yung ano po ba yung mga characteristics nitong Delta variant? So please, tingnan natin yung R0. Ang R0 po, ito po yung level or measure ng contagiousness ng isang variant. So for example, yung original virus that was first described in Wuhan, pwede po siyang infect ng 2 tao. Tapos yung may D614 gene mutation na nag-cause po na first wave sa Europe noong June last year, pwede po siyang maka-infect ng 3 tao. Samantalang po itong more highly transmissible na sinasabi natin UK or alpha variant, pwede po siyang maghawa ng 4 o 5 tao. Pero yung Delta variant po, kaya niya maghawa ng up to 8 persons. Kaya kailangan po tayo talagang pagtibayin yung ating mga border controls at magsika po tayo na hindi makapasok at saka hindi po ito makaspread sa atin.
During an online press briefing, President Duterte said on Monday, wearing face shields both indoors and outdoors is still mandatory, especially with the detection of the new Delta variant in the country. Let's watch this.
That this thing was being discussed openly, and many thought that we were ready to do away with the face masks. But with the kind of aggressive infection that poses a very grave danger to, it's a small inconvenience actually. I know that it is inconvenient really to be wearing the mask, adjusting it from time to time. But that is only a very small price to pay. The face shield.
Yung Delta po, as I have mentioned, is 60% increased transmission over Alpha or yung UK variant, which was already 60% increased transmission over the original virus from Wuhan. So mabagsik po talaga to. If we thought Alpha was mabagsik, yung UK variant, mas mabagsik po itong Indian variant, yung Delta. And of course, there's also the finding that yung mga partially vaccinated, yung one dose pa lang, nahahawa pa rin po sila. Kasi mukhang itong Delta really needs 2 doses para maprotektahan po ng maayos. Yung 1 dose po is not very good at protecting against Delta.
So there are actually several findings from studies conducted by different teams. Kasama na po yung grupo ni Drs. Chu et al. And this is published internationally. And they indicated that meron pong evidence that eye protection such as face shields actually are able to reduce 78% infection. Likewise, they also demonstrated that the use of masks reduced infection by 85%, and physical distancing also reduced infection by 82%. With every additional meter of separation, producing even more protection. And data was able to support this distancing up to 3 meters. So sabi po nung authors, syempre wala pong nag-iisang intervention na pwede pong magbigay ng buong proteksyon. But of course, pag pinagsasama-sama po natin to, nakakatulong.
And even as the Philippines breached the 8 million mark of administered doses of COVID vaccine, President Duterte said he would not gamble school children's health by allowing the resumption of face-to-face classes. In his pre-recorded meeting with the Interagency Task Force for the Management of Emerging Infectious Diseases and some cabinet members in Davao City, the president disapproved the proposal of the Department of Education to resume F2F classes even in areas with low risk of COVID-19 transmission, citing the threat posed by the Delta variant. Take a look.
Dito sa face-to-face, I think I am not inclined to agree with you. I'm sorry, but mahirap. I cannot gamble on the health of the children. I hope you'd understand.
Two basis for the DepEd position on the matter of opening of classes and face-to-face. One, of course, which we consider very heavily is the impact on the economy, because education and the economy are closely linked. The second, of course, is the legal basis for the opening of classes and all other activities. We have a law which was passed last year, Mr. President, wherein it is the President, upon the recommendation of the Secretary of Education, who will decide on the matter of opening of classes.
I can assure them that we will follow the orders. But at this time of a national emergency, I would just like to inform the courts that I will not follow them. I will insist on what is necessary to protect the people. It is not what the legal book says about in the matter of stopping the protocols, the requirements by law.
Following President Duterte's decision, Secretary Biones said DepEd would use technology to deliver classes for the upcoming school year. For the school year 2020 to 2021, which opened in October 2020, the DepEd conducted classes through online learning, modular learning, TV and radio-based instruction, and blended learning, which is a combination of 2 or more methods of learning. Health experts earlier warned that new coronavirus variants were affecting more children.
It's been over a year. It's been over a year since the COVID-19 pandemic forced 60 million Indonesian students to study from home. Schools are finally preparing classrooms in preparation for the resumption of in-class learning in July. Let's hear more from December Paras.
Attended.
Schools have been closed in most parts of the country due to the pandemic in the mid of last year. And with no end to the pandemic in sight, the government has insisted that in-class learning will resume when the next academic year starts. It's for the sake of the students whose right to education has been adversely affected by the health crisis.
President Joko Widodo gave his approval for in-person learning in the upcoming academic year starting in July, with strict requirements to ensure a safe return to schools during the COVID-19 pandemic. The government has decided that only 25% of the total number of students are allowed to attend classrooms at a time, Health Minister Budi Gunadi Sadikin said after a meeting with the president at the State Palace in central Jakarta. Students' attendance is limited to twice per week, and classroom activities will last only 2 hours per day. In-person learning is not a mandatory. Parents can still opt for remote schooling, he said. The president has instructed that in-person learning must be held with extra cautions. Moreover, school reopening requires all teachers and staff to be fully vaccinated. The government has therefore included 5 million teachers on its priority list for the national vaccination program, although a report says only 1/5 of those have been inoculated so far.
Yes, I am very aware of the Indonesian government's decision of in-class learning. And as a preschool teacher, I look forward to developing social skills with all of my students. And we are very fortunate that the school that where I am in is have scheduled teachers for vaccination already, and I am fully vaccinated. And so if the school has agreed to open, I am hopeful that we are able to follow protocols and we are able to maintain a good standard so that all of our children and all of our students and staff and teachers are all safe and they are able to come and learn all these skills that we have.
Every school in Jakarta have different setup. For us teachers, we have been reporting in our schools, in our classrooms, while the students is in their comforts of their home. So if the government decided to have this face-to-face learning, I think we're ready. I just received my first vaccination this June and I'll receive my second on August.
The Education, Culture, Research and Technology Ministry has made it clear education cannot wait for the pandemic to be fully under control, as nobody knows when that will happen. In other words, reopening schools is a difficult choice, but a bold decision must be made for the greater good of children. A school's preparedness is measured by, among other things, classroom setting in compliance with physical distancing rules, hand-washing facilities, temperature check devices, and internal mechanisms to prevent crowds.
The question is, are we really well prepared for schools to reopen? For sure, we are set to go through another cautious school year. The sooner the government flattens the COVID-19 transmission curve, the faster it can realize education for all. Reporting from Jakarta, Indonesia, this is December Paras. We live in interesting times.
And staying in Indonesia, the country passed 2 million coronavirus cases as infection rates soar and hospitals are flooded with new patients, prompting warnings that the Southeast Asian nation's health crisis could spiral out of control. The unwanted milestone comes after daily case rates more than doubled in recent weeks, and authorities identify the presence of highly infectious COVID-19 variants. On Monday, official figures showed that Indonesia had recorded a daily record high of 14,536 cases, taking the total to just over 2 million, with nearly 55,000 deaths among a population of nearly 270 million. But those figures are widely thought to be a severe undercount due to low testing and contact tracing. Some experts have said that official cases may only be about 10% of the real number. Hospital occupancy rates have soared to over 75% in Jakarta and other hard-hit areas, while funerals for COVID-19 victims have also reportedly jumped. The Indonesian Medical Association said the variants appear to be sickening younger people. The association's COVID-19 spokeswoman, Erlina Burhan, said previously COVID-19 patients were elderly or those with pre-existing conditions. But since the virus variants were detected, a lot of patients were younger and did not have pre-existing conditions. Widespread rule breaking on mask wearing and other health protocols, as well as vaccine skepticism, are among factors cited for the worsening situation. The World Health Organization has called for tougher movement restrictions. Indonesia's government, widely criticized for a weak pandemic response, said it would temporarily beef up restrictions in the capital Jakarta and other hotspots. Indonesia's government said Monday it would temporarily beef up those sections. Indonesia is ramping up inoculations as well by expanding the program to anyone over 18 and eyeing incentives such as giving away free live chickens to older people willing to get jabbed in a rural part of West Java. But there is widespread misinformation about the pandemic, and many are skeptical about vaccines.
We head on now to Vietnam, where Da Nang is ramping up virus testing following a new community outbreak. Plus, Hanoi reopens barber shops and indoor dining as some restrictions ease. Here's Ralph Wandop Empire joining us live from Vietnam for more. Ralph?
Hi there, Sheila. Good afternoon. How are you doing?
Hi, thank you for asking.
That's correct, Sheila. Da Nang is ramping up its coronavirus testing to contain the outbreak in the city after 33 community cases were detected since last week and after several weeks of no community infections. The groups to be tested are workers in industrial parks and production facilities and those who directly provide services to customers. The workers in industrial parks and production facilities will be tested every 7 days, according to decision number 2787 of the Ministry of Health. People in concentrated quarantine facilities due to close contact with COVID-19 cases will be tested within 24 to 72 hours before being put into the facilities. Those providing direct services to customers will be tested periodically once a month. The city will also test people working in medical facilities and pharmacies, civil servants, public employees, and workers who go on business trips outside the locality. Those who are working in places with many people, poor ventilation, higher risk of infections such as administrative centers and reception departments in people's committees at all levels. Now in other news, Gila, Ho Chi Minh City continued to account for most cases as Vietnam reported another 47 domestic COVID-19 infections this morning. 36 cases were recorded in Ho Chi Minh City, 9 in the northern province of Bac Giang, and one each in the central province of Nghệ An Province and the Central Highlands Gia Lai Province. Ho Chi Minh City reported yesterday 166 domestic coronavirus cases, the highest single-day count ever since the virus first hit Vietnam early last year. Ho Chi Minh City's daily infections have stayed over 100 cases for 5 days, according to statistics by the Ho Chi Minh City Center for Disease Control, or HCDC. Bac Giang in the north and Ho Chi Minh City suffered the highest number of infections, 5,466 in Bac Giang and 1,820 in Saigon. These are the country's biggest COVID-19 hotspots currently. The country has more than 13,500 cases since the pandemic hit. These cases are recorded in 42 cities and provinces. Up to now, there are 5,453 COVID-19 patients in the country have fully recovered, including 224 people discharged from the hospital today. The country's COVID-19 death toll has risen to 69 after 3 more deaths were confirmed today. In related news, Ho Chi Minh City is trying its best to give 804,000 doses of the COVID-19 vaccines to its residents within 5 days. The city's Vice Chairman Duong An Duc said at a meeting yesterday. According to Duc, who is also Vice Head of the Ho Chi Minh City Committee for COVID-19 Infection Prevention and Control, the city received 836,000 doses of the AstraZeneca COVID-19 vaccine donated by Japan late last week. Among them, 30,000 doses have been handed over to the Ministry of National Defense and 20,000 others to the Public Security Force to vaccinate soldiers and the city police. The local authorities are responsible for delivering the remaining 804,000 doses to the citizens. The city launched its largest ever vaccination campaign on June 19 and began mass vaccination this afternoon. It plans to finish injecting 804,000 doses in 5 days. Furthermore, Ho Chi Minh City may purchase up to 10 million COVID-19 vaccine doses this year, the Municipal People's Committee stated on Monday. Duong An Duc, Deputy Chairman of the People's Committee, said 5 to 10 million vaccine doses would arrive in the city through direct negotiations with manufacturers without any third party involved. The exact terms of these contracts would be announced in further detail once signed, he added. So far, the southern metropolis has received nearly 1 million vaccine doses from the central government. Ho Chi Minh City's ongoing COVID-19 vaccination campaign, expected to end on June 27, would administer around 200,000 vaccine shots a day across 650 checkpoints. About half would be given to workers and managers at industrial parks and high-tech areas to ensure an uninterrupted production chain, amounting to around 340,000 people. Now, good news for Hanoians, or for those who are in Hanoi. With the COVID-19 situation under control in Hanoi, municipal authorities have approved the reopening of indoor dining and drinking venues along with barbershops. The city requires restaurants to ensure social distancing between customers and have dividers between seats. Establishments can't fill more than 50% of their seating capacity and have no more than 20 people in a venue at a time. They also have to close before 9 p.m. every day. Bar, pubs, and draught beer venues are only allowed to sell takeaways. The capital had shut down non-essential businesses and services starting April 29, beginning with karaoke parlors and bars, then restaurants and cafes, and later cinemas, gym, and barbershops. Chan Dak Fu, former head of the General Department of Preventive Medicine under the Ministry of Health, warned last Saturday that outbreaks were still happening in the country and Hanoi could still be harboring infected cases within the community. Back to you, Gila.
Yes, thank you, Ralph, for that update, and please keep us posted. Stay safe and healthy.
You too, Gila, reporting live from Da Nang, Vietnam. This is Ralph Mandel Empire. We live in interesting times.
From Vietnam, let's go to Bangkok, where the country has eased the city of Bangkok has eased some virus restrictions. Let's find out what these are, the details from Veronica Carino, joining us live from Thailand. Hello, Veronica.
Hello, good afternoon, Alma. Bangkok Governor Police General Aswin Kwanwang issued an announcement relaxing some restrictions on the operation of certain businesses and activities in Bangkok under certain conditions, as published in the government's Public Relations Department website. Let's listen in.
So these measures include allowing restaurants in Bangkok to operate until 11 p.m. or 2300 hours. Unfortunately, the ban on alcohol consumption within the restaurants still remain in place. Also, for restaurants that don't have air conditioners, that are open air, they are allowed 100% capacity seating capacity. For those restaurants that are air-conditioned, they are allowed only 50% capacity seating. Entertainment venues, including karaoke bars, pubs, and discos, have to remain closed. However, department stores are allowed to operate until 2100 hours or 9 p.m. The Bangkok Metropolitan Administration has also allowed public swimming pools and other water sports facilities to reopen, and sporting events without spectators are also allowed, and I'm sure this is very much welcomed for many of you who depend on physical therapy. Also, education centers, science parks, and public and privately run libraries are also allowed to reopen. However, gatherings are only permitted for a group of no more than 50 people, and mandatory wearing of masks in public venues also remains in place.
The announcement came after the Bangkok Metropolitan Administration Communicable Disease Committee approved it. It will go into effect starting Monday, June 21st, 2021. According to the announcement, the following types of the activities and venues may be open, but with the government imposing strict COVID-19 prevention measures. Public swimming pools and other activities of a similar nature. Water sports facilities and other water activities in public ponds with limitations on the number of participants, in which the venues must close at 9 p.m. Learning and science centers for education, science parks and galleries, public, private, and community libraries. Eateries can stay open up to 11 p.m. but cannot serve alcohol on the premises. Eateries with air conditioning may only occupy up to 50% of the seating capacity. Sports venues, outdoor or indoor exercise grounds with good air circulation may open until 9 p.m. Competitive events are allowed without spectators. Convenience stores and supermarkets may resume to normal operations. Group activities that could spread the virus, such as conferences, seminars, social gatherings, camping, film production, and religious activities are permitted, but with the number of participants at any given event cannot exceed 250. If the number of the participants is estimated to be greater than 50 but less than 500, the organizers must first obtain authorization from the district office in charge of the region by presenting a working plan and disease control measures. Except for activities carried out by government agencies or are conducted in the venues designated as quarantine facilities, organizers must request authorization by submitting a working plan and disease control measures to the BMA Health Department in circumstances where the number of participants will exceed 500. Anyone who violates or fails to comply with this announcement may be charged with an offense under Section 52 of the Communicable Disease Act BE 2558 of 2015 and face up to a year in prison or a fine of up to 100,000 baht or both. Furthermore, they may be charged with an offense under Section 18 of the Emergency Decree on Public Administration in Emergency Situations BE 2548 of 2005, for which they might face up to 2 years in prison or a fine of up to 40,000 baht or both. Back to you, Alma.
Thank you very much, Veronica, for your updates there. Please stay safe.
Thank you, Alma, and likewise, reporting from Thailand, this is Veronica Carino, and we live in interesting times.
Cambodian Prime Minister Hun Sen said Saturday he has cancelled talks next week with British Foreign Secretary Dominic Raab after the Southeast Asian leader came into contact with someone infected with coronavirus. Hun Sen wrote in a Facebook post that he had indirect contact with a COVID-19 patient, and doctors required he be tested and undergo quarantine for 14 days until July 3. Raab was expected to visit Phnom Penh early next week, according to Cambodian officials. Hun Sen's quarantine comes as the country reported 20 deaths from the virus on Saturday, the highest number in a single day since the pandemic began. Cambodia has seen infection numbers surge since February when an outbreak was first detected among its Chinese expatriate community. The country's total number of cases has now climbed to 42,052 with 414 deaths. 7 cases of the Delta variant have been found among people returning from neighboring Thailand, the Cambodian Health Ministry said Saturday.
Meanwhile, Malaysia is also ramping up its vaccination drive in a race to stamp out the variant, especially the variant of concern, the Delta variant, where the health ministry detected 21 out of 183 samples received. Here's Alfred Balmes for more.
A global report by the World Health Organization confirmed that the Delta variant, also known as B16172, has become the dominant strain in most countries now. University Putra Malaysia Medical Epidemiologist Associate Professor Dr. Malina Osman said, based on the sampling report done by the Health Ministry, 3 variants of concerns have been identified in Malaysia as of June 19. The Beta variant B1315 in 137 cases, Delta in 21 cases, and Alpha B117 in 9 cases. However, Dr. Malina said the actual prevalence of variants in the country was unknown due to limited data being released in the methodology and actual samples being sent for detection. University Malaya epidemiologist Professor Dr. Awang Dulgiba Awang Mahamud agreed there's a need to increase random sampling of viruses from cases in the community to be able to detect the prevalence of different variants in the community. To ensure the country achieved optimal protection from the Delta variant, Dr. Awang also suggested vaccination be increased to between 300,000 and 500,000 doses per day, and that the interval between the AstraZeneca doses be shortened from 12 weeks to 3 or 4 weeks. Meanwhile, Malaysian Medical Association President Dr. Sobramian Mulyandi said Malaysia should implement effective tests, trace, and isolate methods to control the spread of new variants in the country. They suggested to continue to vaccine high-risk group first, and if the vaccine supply is adequate, should also start vaccinating factory, construction, and retail workers. Medical Practitioner Coalition Association of Malaysia President Dr. Raj Kumar Maharaja said, although the Delta variant was not as pervasive here as in other countries where it had been dominant, existing cases need to be quickly detected and isolated to prevent its spread. He suggested the speedy vaccination process and even called for general practitioners across the country to be mobilized to support the national vaccination drive. He further added the deployment of more mobile vaccination units to reach the disabled, bedridden, and the poor must be put in place as well. Back to you, Alma.
Yes, I think you said a few already, but are there other steps that the government is taking to curb the spread or to protect the population from these variants in Malaysia?
Yes, Alma. Malaysian government is non-stop in its effort to curb the spread of variants of concern in the country. Not only that the government has ordered nationwide lockdown since early May till end of June, They also impose much stricter SOP, such as shorter operating hour for malls, restaurant and shop providing essential, no dine-in at any restaurants but only take-out orders, and no interstate and inter-district travel. Under the new SOP, the government also imposed 80% of civil servants and 40% staff from the private sector to work from home since the start of the nationwide lockdown. And at present, the vaccination rollout is now being accelerated in order to protect more people quickly. More vaccination centers have been opened and private clinics may soon provide vaccination service as well. Just 2 days ago, the Health Ministry has authorized the use of Pfizer vaccine for school children aged 12 to 17 years old. The children are expected to get their jobs in school starting in July. Every state in the country are actively doing their part to make sure that all the citizens and non-citizens residing in Malaysia get the vaccine as soon as Alma.
All right, thank you very much for your time, and you do take care. Stay safe, Alfred.
You take care too. Live reporting from Kuala Lumpur, Malaysia. This is Alfred Balmes. We live in interesting times.
And the news continues here on Eagle News. Sheila and I will be right back.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced. Not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas. A 1-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia. Tune into Mata ng Aguila, the evening primetime news program of Net25. Balanced and objective, Mata ng Aguila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to thank our help outdoor
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
Welcome back to ASEAN in Focus. Meanwhile, President Rodrigo Duterte on Monday warned of defying a possible court order to suspend quarantine protocols in Cebu. This after two Cebu-based lawyers filed a petition before the Cebu City Regional Trial Court seeking to stop the enforcement of the 10-day quarantine for overseas Filipino workers and returning overseas Filipino workers to Cebu. The president also ordered the Department of the Interior and Local Government, or DILG, to decide on the issue concerning Cebu Governor Gwendolyn Garcia's travel protocols in the province. Let's watch this.
Si Gwen naman, she went to see me the other week. And I assured her that we are fair. And we would like to, I see the wisdom in her view, but I said the overwhelming notion among us in government and the medical doctors simply do not agree with you. So I leave the fate of Governor Garcia sa DILG. So, yung mga korte, hindi naman sa'yo, wag na lang ninyo ipalabas. Kasi magkakaroon tayo ng impasse. And I do not want to lock horns with the judiciary. I said, nirerespeto ko. But there are times that, may panahon na there is always a time that the courts can function normally and maybe grant injunctions and all. But this time, I said they're put to notice that hindi ako magpipigil. I will not obey the courts in the matter now of management the pandemic. I do not want anybody from any government agency or department messing up with a situation which is, I said, is being managed because it is very dangerous.
Recall Malacanang ordered to divert international flights bound for Mactan Cebu International Airport to Ninoy Aquino International Airport from May 29 until June 5, 2021, amid Cebu's deviation in the IATF's travel protocols.
Staying in the country, Health Undersecretary Maria Rosario Vergere said various factors have given rise to the increase in new coronavirus cases in Visayas and Mindanao. Some of them are the clustering of cases in workplaces and prisons. Let's listen in.
Chain of transmission, hindi ho natin na ito po sa Mindanao, nakikita natin, not just in Mindanao but in Visayas. Unang-una, lagi po natin sinasabi, pag may tumataas po na kaso sa bawat lugar, we need to look at multitude of factors because we know that there are these different factors which causes the transmission of the virus. So unang-una po, meron ho tayong pang-individual at pang-komunidad, yung pagpapatupad po natin ng minimum health protocols. At pag tinignan natin, there are reports already coming to us from our different regional epidemiology and surveillance units na talagang mukhang nagkaroon ng complacency sa pagpapatupad ng health protocols. Pangalawa, meron na ho tayong na-note na clustering of cases in these different areas na meron hong mga tumataas na kaso. May identified po tayo na clustering of cases in workplaces, clustering of cases in prisons. So nakikita ho natin na yung chain of transmission hindi ho natin naaagad at hindi po natin naaagapan. Kaya po nagkakaroon tayo ng clustering of cases. And the third, totoo po na meron na ho tayo na-detect na mga variants sa iba't ibang lugar dito sa Visayas and Mindanao. And this can also be drivers of the infection. But let us not just rely or let us not just say that it's just because of the variants. There are a multitude of factors. Kailangan po kapag tayo ay tumitingin sa response natin, it's a continuum. So we will need to address not just the variants but also the other forms of response that we are having. So sana po yung ating mga kababayan, tuloy-tuloy po ang pagtulong sa ating gobyerno para mapababa na po natin ang mga kaso sa Visayas and Mindanao.
Meanwhile, deposed Myanmar leader Aung San Suu Kyi on Monday thanked her supporters for defying the junta to celebrate her 76th birthday as her trial for flouting coronavirus restrictions and illegally importing walkie-talkies resumed. Let's listen in.
Muini Piatan Gabonli or maybe Paus and I mean Muini Nepata Biduri Alung Asu down Penny Javare, Amil the Nizaga Pala de Kama, Biduri Alung or Jesu Temare, Lura Mia Pioba.
Protesters across the country on Saturday donned flowers in their hair, long a signature Suu Kyi look, to mark the birthday of the democracy icon who turned 76 under junta house arrest. Many replicated the floral hairstyle and uploaded pictures onto social media, from a former beauty queen to rebel soldiers. Suu Kyi's trial on a raft of criminal charges resumed. The hearing heard testimony that Suu Kyi broke coronavirus restrictions during last year's elections, that her National League for Democracy, or NLD party, won in a landslide, and illegally imported walkie-talkies. Brief meetings with her legal team have been the only channel to the outside world for Suu Kyi, who remains widely popular in Myanmar since she was detained in February. Last month, she used her first in-person court appearance to voice defiance against the junta, affirming that her NLD party would exist as long as people exist because it was founded for people. Junta leader Min Aung Hlaing has justified his power grab by citing alleged electoral fraud in the November poll, and has threatened to dissolve the NLD. Suu Kyi's lawyers have said they expect the trial to wrap up by July 26.
In a related news, the EU added 8 officials from Myanmar's junta and 3 firms linked to the military to its sanctions blacklist over the country's February 1 coup and bloody repression of protests. Those targeted with asset freezes and visa bans included the Interior, Security, Finance, Natural Resources, and Transport ministers, according to listing published in the EU's official journal. The 27-nation bloc put the state-run gem and timber enterprises on the list as they look to cut off key revenues to the junta. It also added the Myanmar War Veterans Organization, which acts as a reserve force for the military, to the blacklist. The latest additions take the number of individuals and entities sanctioned by the EU to 35 since the bloc's first round of punitive measures agreed in March. The U.S. and Britain have also targeted key officials and enterprises in the country, but so far the junta has shrugged off Western pressure. London also announced sanctions on the same companies as well as the military junta's ruling body, the State Administration Council. The Foreign Commonwealth and Development Office said the move to curb trade in the 2 high-value commodities would deprive the generals of millions of revenue.
Department of Trade and Industry, or DTI's Secretary Ramon Lopez said the country's free trade agreements, or FTAs, have opened more opportunities overseas for Philippine construction industry.
Associations, or EFTA, in the global market. In this regard, the Philippines' participation in the FTA, or free trade agreements, is providing an avenue to allow greater economic activity and job generation, especially with the construction industry. FTAs offer a more stable, predictable, and fair environment for Filipino businesses and investments, including those in the construction and related engineering sector. For local construction services, the Philippines was able to secure liberal arrangements in foreign markets, including 100% foreign equity participation in activities like general construction work for buildings and civil engineering, among others. Philippine-based businesses are guaranteed this arrangement through its existing FTAs with ASEAN, Australia, China, the European Free Trade Associations, or EFTA, Hong Kong, India, Japan, Korea, and New Zealand. These presently provide Philippine construction-related companies the opportunity to do business in these markets and provide their services to these countries on a non-discriminatory basis.
During the virtual conference on Philippine Overseas Construction Board, or POCB, Monday, Lopez said that through the EFTAs, the government has secured liberal arrangements in foreign markets for local construction services. These liberal arrangements in the construction sector include 100% foreign equity participation in construction activities such as general construction work for buildings and civil engineering. The trade chief said exploring these opportunities overseas will also help construction-related enterprises to recover due to the impacts of the pandemic. Tall, thin, and brightly colored Hanoi's tube houses dominate city's streets as 9 million people compete for space in Vietnam's bustling capital. Let's watch this.
Chung cư là thứ nhất là mình được ở cái mảnh đất nó là thuộc cái sở hữu của mình. Khi mà mình xây dựng trên cái mảnh đất đấy thì là đảm bảo cái không gian theo ý thích của mình, phù hợp với lại cái thiết kế về nội thất cũng như là ngoại thất.
Theo tôi ở nhà ống thì nó có một số cái bất lợi như là do diện tích hạn hẹp cho nên là không thể bố trí được các sân vườn hay là có quang cảnh đẹp cho ngôi nhà được. Thứ hai là do tiếp giáp với các nhà hàng xóm xung quanh cho nên không có ánh sáng và không khí trong lành cho ngôi nhà. Cũng như là ở lâu dài thì chúng ta sẽ phải mất một chi phí bảo trì tương đối lớn so với chung cư.
As always, thank you, Gila, for keeping me company today.
You're very much welcome, Alma. And that's the latest news in the ASEAN region. And thank you for joining us today here in ASEAN in Focus. This is Gila Pablo from EBC Thailand Bureau, and we live in interesting times.
And we'll see you back tomorrow. I'm Alma Angeles. We live in interesting times.
Mga kaibigan, sa panahon po ngayon na ang tao ay dumaraan sa iba't ibang mga pagsubok sa buhay,